First of all, it's my pleasure to introduce Didier Jourdan, who's the UNESCO Chair on Global Health and Education, also a Professor and Head of the World Health Organisation's Collaborating Centre for Research and Education. And health, like it seems most of our presenters, is on the governing board of the UNESCO Institute for Information Technologies and Education, and has devoted his entire career to capacity building in the field of health. Over to you. Thanks very much.
Good. So, hi everybody, I'm really happy.
Is it better? Yes. I'm really happy to share some of the results of the work of the UNESCO Chair and WHO Collaborating Centre Global Health and Education. But I'm aware that this is the lecture that is just right in the middle of the map. And you know, since it's going to be about health and well-being, I would like to tell you that I respect your biorhythms, and that if you need a map, it's not an issue, because I'm just going to begin by the conclusion, so you will know everything. And of course, you know, I just would like you not to snore too loudly during the lecture. Okay, does it work? Okay, so what are the 5 ideas we just would like to share with you during this talk? First of all, this is about what's health. Health is not something that is given. Health is something that has to be created by the people. The second idea is something we already talked about this morning. You remember? Formal, non-formal, informal education. In the field of health, these 3 dimensions are critical. The third idea I would like to share with you is what is lifelong learning for health? To summarize, what do we all need to know and to be able to do just to be healthy as individuals and as communities? Local communities, global communities. The fourth idea is going to be much shorter because I removed many slides, just because this is what you already said this morning, all the great speakers we had. And finally, the last idea is, okay, so what? How could we move forward? But there's one thing that is the key stuff in the field of health. Teaching creative and critical, thinking is not an option. This is the only one that matters. It's not an option among others, just because of the nature of health. So why talking about health today? This is just because, first of all, this is your main concern in life. It's not me, this is all the surveys shows the same. The main concern in life of individual, and of course, it's a global big stuff. First idea, as I already said, health is not given. It is created. We all shape and build health together by all our actions as individuals and as communities. Then if we think about education in the field of health, we of course need to stop thinking that health is defined by medicine with key criteria that we just implement and for people to follow the rules. It's not like that. It doesn't work. And the key question is how to create the condition for health. And to create the condition for health, we need citizens, individuals, people, communities that are able to act at a local level concretely to shape health. Then when you say we have to create health, what does it mean? Oh, it's super simple. We just need a little shift. You know, this is an iceberg. It just represents our common vision of what is health. What we see when we think about health, it's your general practitioner, your nurse, your pharmacist, and the hospital. Yes, but no. Yes, but no. This is 10 to 20% of your health. Your health depends on other determinants that are biological, who you are, of course, social, cultural, environmental, and behavioral. What is the key lever of change when it's about environmental, social, cultural, behavioral determinants of health? Of course, it is education. So we need to stop thinking health is a given, we have the key rules, you apply the rules, you're going to be healthy. No, it's not like that. We need to think, to be creative and critical. And it's all the more important since now we do not realize where we are living. You know the blue marble. This is the planet you think you live on. That's not true. The real planet you live on is this one, which is super small. Listen, remember to what our colleagues said this morning. So we have to realize when it's about creating health in your life, in the life of your family, of your community, it's also be aware that your health, the health of yours, is directly connected to the health of all the human beings and all the living beings on this planet, just because we are sharing the megatrends and all the changes at a global level. So thinking about education in the field of health need to move from a perspective that health as, given to health that we have to create and, of course, co-create with the people and all the other actors, knowing that when it's about co-creation, artificial intelligence is a key and a major tool by its capacity to integrate many informations. ID number one, okay? ID number two, where do you learn what you know about health? Of course, mom and dad, your grandma, your family, your cousin, your neighbors, your friends, your football or rugby trainer, the priest, the people in charge of the museum. Health is not only part of the curriculum, it is something that we are talking about everywhere. You know what? Sometimes I'm thinking of the prehistoric times. You know, the cave woman and the caveman. And I say, hey guy, what did they talk about around the fire? About philosophy? About what happens after death? Probably yes, but they mostly talk about health. How to survive, what to eat, where to sleep. It means that thinking about health in educational terms means thinking through the lens of the formal, non-formal, informal learning. And I just would like to share, this is Tigran's slide, it's not mine. This is the work of the UNESCO Institute for Information Technology and Education. Just think, if you ask the young people where they find information about sexuality, of course, school is important, but it's mostly friend and social networks and digital spaces. So, no problem at all. It is just as it is. But if you want to educate young people, to help them to become creative and critical thinkers in relationship to health, you need to find a way to create coherence between all the sources of education. Third ID now. What is the content? What do we have to transmit, to share when it's about health? Everybody always think of what we could call health literacy. This is the basic knowledge. What you need to know to protect and promote the health of you, your family, your community. But of course, it's not only that. It's the question of citizenship. It's the need to provide people with all the knowledge, the skills, the capabilities necessary for actively participating in decisions about health as citizens. And you know, there's a lot of decisions that have an impact on the health of the people. Just think the transportation means you took to come here. So it's not, again, an issue. It's just we need to move from a very medical and kind of prescriptive and sometimes moralizing vision of education in the field of health to think from the angle of citizenship education. To do that, we need to put together all the formal and informal contribution to health education to create what we call a health learning pathway all over the life. Don't forget, the senior people, even the dependent people, they learn about health just because they have to adapt their life to their health conditions. So this idea of creating a health learning pathway along life, this, we call that health learning pathway, but there's many other ways of shaping it on an island or in a big country, in a small community. It's always to say, okay, where do we learn about health? Family, peers, medical facilities. Remember the last time you met your GP, was it only a technical meeting saying, okay, you need okay, you have inflammation, you need a drug? No, of course not. You learn about your health. This has to be coherent if we want to help people to become creative and critical thinkers. So this is probably something that is critical when we think about health and creative education in general. We need to think of all the contributions of education, to value them, of course to share them, to align them at a local level, and then try to improve them when needed. Idea number 4. The idea number 4, it's about the question of assessment. I skip on my side because, you know, the big boss of OECD was there, so no need for me to explain what you are doing and what you described earlier today. Just one thing. If you think about assessment, of course, artificial intelligence has a key impact on that. It's also a way at individual and collective level to reorient learning. But we also have to think that the result of research shows that the key issue is more the participation of the people. If learners are not involved in the assessment, especially when we use artificial intelligence, it's becoming extremely dangerous. They could become object instead of subject of education, and this is of course something that has been the OECD documents. In the field of health, if we think of what we want to assess at the end of the educational process, I would like to invite you to think from a different perspective, because in general we say, okay, the kids need to know that drugs are dangerous. That's totally true. That, you know, driving a car when you're, you know, under the power of alcohol is also dangerous. Eating only fries and Coca-Cola every day, they need to know that. But the problem is that knowing that is not enough. It doesn't work. You know a lot of things that are not good for your health, and you're doing them. Okay, don't say that. The point is we need to think from another perspective. We need to think from the point of view of what health, what shapes health. This is the determinants. Then to define the key competencies, to think inventively, to solve the problem, and to innovate. And in different contexts. Of course, here in Paris and in Mauritius, the contexts are totally different. But we need to equip the people with that. And this is something we are doing, our UNESCO Chair, because the co-chair, Nick Lagre, is here with me. We are just trying to support countries, regions, different structures in building the educational activities that, you know, fit to the needs and to the competencies that have to be developed. The only thing I would like to talk about assessment is the teachers. Okay. This photo is the photo of 100% of the teachers of this planet. If you, in your country, in your organization, you have a teacher who's, I would say, for example, in May, for the North Hemisphere, come and say, oh, I'm sorry, I'm at the end of the curriculum, I don't know what to do, please, can you give me more work? It doesn't exist, by definition, because there's no limits in the work of teachers, in our work as So the problem we have with assessment in general, and especially in the field of creative and critical education, is that it's very often seen as more work. You talked about this morning add-ons and the fact that we need to include that. And for me, and this is also what we are doing, it's a question of professional identity. And what is the key? And I spent 10 years being the director of a teacher training faculty. It's not the content, it's how we help them to build their professional identity that is different from yours and mine. And we know what are the factors that help shaping activity and identity. And clearly, yes, this is extremely important to think from the lens of the professional identity of teachers. Because the guidelines, the institutional documents, they are part of what shapes the identity. But there's many personal and context-related factors. Just to tell you, this is what we are trying to do within our UNESCO Chair and WHO Collaborating Center. You can go to the website if you want to see the kind of brochures we are producing. Now, the final part of my talk is the so what. I think there's a good chance that most of you agree with what has been said this morning and what I'm saying. So how could we contribute to orient and support social change in order to improve health, reduce inequalities, promote creative and critical learning? Okay. The first thing in the field of health is that we are always repeating the same thing. Everywhere now, and especially in the Western countries, people say, oh my God, the mental health of young people, red alarm, it's a big issue. And that's true. We are close to 20% of the adolescents in our countries that are in need for help. And then we're going to develop an intervention, a program that we're going to implement in schools to influence the mental health of people. This is exactly the same case of this guy who was searching the keys near the street light. We have this problem that, in fact, if you want to know what are the determinants of the mental health of young people, you need to think about many determinants that are not under the street light. And this is the key. And to do that, there's only one solution. This is what we call, there's other names. We call that knowledge production and sharing ecosystem. You cannot do that alone. You as researchers, you as education leaders, you cannot do that with the young people. You cannot do that with the professionals. Then you need to create the conditions for the collaboration between this scientific knowledge, the professional knowledge, and the experiential knowledge. And this is what will help us to invent, create the new solutions. If you're interested in that, you can have a look on this paper in the Lancet that we wrote with Nikki, trying to make clear, in terms of strategy for member states, for countries, what are the key levers of change that could help us to put in practice what we just described. So this journey is close to the end, just a conclusion. Health is not given, it is created. We learn about health everywhere in our life, formal, non-formal, informal. Learning for health, it's not only individual, it's collective. To do that, we need to strengthen the assessment and contribute to the evolution of teacher professional identity, and we need a strategy. To conclude then, and this is the last slide, Remember, I gave you the conclusion at the beginning, and nobody snored. I'm happy with that. In health, teaching creative and critical thinking isn't one option among others. It's the only one that matters. But we cannot do that with the people. We cannot do that with the young people, with all the professionals. And of course, you can see that classical references for that. Thank you very much.
Thank you. Didier, thank you very much. And, you know, I think creativity often happens and insight often happens at the intersection of different disciplines. And certainly for those of us who sometimes get stuck in thinking about education, to have that perspective coming in, you know, someone coming in from the health education side, kind of gives a clarity that sometimes we miss in our own, when we get caught up in our own debates. So I think we're moving straight on. So thank you very much.
Thanks.
No time for questions.